Hi, my name is Maria Prias. I am doing my mental health assessment for RN52. First, when you assess a mental health patient, you want to identify who they are. So you want to know their demographics, where do they live, what their age is, their date of birth. And then you want to verify their symptoms here, if they're being paranoid, hallucinations, any type of symptom. Then you will assess for their mental health history. If they have a mental health history, a mental health diagnosis, you want to get the date when they were diagnosed, at what age, and if they're taking treatment, they're doing medications for it. Then you want to ask about their socioeconomic history, for their employment, their sexuality, their education. You also want to know their strengths and for family support or support system, who helps them. You want to have a medical history, if they have any prior medical conditions that can affect their psychosis. You want to know any prior hospitalizations, and if they've been hospitalized, what were they hospitalized for, and when was the last time they were hospitalized. Any history of surgeries, any medications that they are taking, can be prescribed, not prescribed, herbal supplements, vitamin supplements, and then you want to know if they have allergies to medication, food, latex, or environmental allergies, and what kind of reactions they have to the allergy, and if they take anything for it. Then you want to ask about substance abuse, if they are using any illicit drugs, and if they are, what they're using, how long they've been using, when's the last time they used, if they smoke, how much they smoke, are they ready to quit smoking. Alcohol, you want to know how much, if they drink alcohol, when's the last time they had an alcohol beverage, on an average, how many alcoholic beverages they have a day. And then you want to go over their family history, if there's any health conditions that runs in the family. It could be heart, but for this specific, we're looking more into mental health disorders like anxiety or depression or any mental condition. You also want to do a skin assessment, make sure that they're not hurting themselves, or any wounds, lesions, and infestations in their scalp, their hair, if they have any visual problems, hearing, with their nose problems, swallowing, or problems with their throat. And then to do an actual mental status exam on a patient, I picked schizophrenia, and the DSM-5 code is 295.90, which is characterized by range of cognitive, behavioral, and emotional dysfunction. For a mental health exam, you are going to go over their appearance, how they look, if they do direct eye contact, their grooming, if they're clean. You want to see if their clothes is disheveled. They will go and look at their attitude, like if they're suspicious, guarded, paranoid. For speech, it would be hesitant. Sometimes they'll have normal vocabulary and have no problems articulating. And then we'll look at their affect and mood. So for somebody with schizophrenia, they'll be blunt or flat. They have anxiety, but most times can be stable. Then you want to assess their thought process to see if they're coherent and logical, and if their thought process is relevant. And then thought content. For schizophrenia patient, they would have paranoid thoughts. And then if you want to know if they have any suicidal or homicidal ideations or intent or have a plan to commit suicide. Perceptual disturbances, if they have, they could have auditory hallucinations as well as paranoid delusions. They can feel like they're being followed or chased. And then you want to do an orientation and level of consciousness. So you want to do verify their name, their date of birth, so person, the place, time, and situation. And then cognition, you do a series of tests, and one of them is a serial of 7, where they count from 7 backwards, starting at 100 until they get to 60, and then they do a memory test to see if they have an intact and accurate, and if they can do a shape interlocking. And then we'll do an insight to see if they are they're accepting their diagnosis and willing to seek help. And then judgment, you do see if they have a good judgment. So you ask them a question. If they find a stamped envelope, what would they do? So you would determine if they have a good sense of judgment. So this completes my mental health assessment.